Have you ever wondered why leukemia is called a cancer of the blood and bone marrow? Today we will explain leukemia simply, just like a clear medical classroom overview you can follow step by step. Leukemia can affect children, young adults, and older people, making it important across all ages and medical specialties. We will cover definition, classification, diagnostic techniques, key lab findings, and the major leukemia types. Throughout simple animations and labeled diagrams will make complex concepts easier to understand. Before that, don't forget to subscribe to this channel for regular paramedical videos. Let's begin with a clear definition and the basic way clinicians classify leukemia. Leukemia is a group of cancers originating in blood-forming tissues, causing abnormal proliferation of white blood cell precursors. Clinically, we broadly divide leukemia as acute or chronic based on disease, speed, and cell maturity. We also classify by lineage, myeloid versus lymphoid, indicating which blood cell line is affected. Related disorders include chronic myeloproliferative diseases and myelodysplastic syndromes, which can overlap with leukemia features. Classification matters because it guides diagnostic testing, prognosis, and treatment decisions for each patient. Next, we'll look at the diagnostic techniques clinicians use to identify and classify leukemia precisely. Diagnosis starts with clinical suspicion based on symptoms like fatigue, infections, bleeding, or abnormal blood counts. A complete blood count and peripheral smear are first-line tests to detect anemia, thrombocytopenia, leukocytosis, or circulating blasts. Bone marrow aspirate and biopsy confirm the diagnosis, estimate blast percentage, and evaluate marrow architecture. Flow cytometry identifies cell surface markers to determine lineage and subtype, while cytogenetics and molecular tests find key mutations. Important lab findings include high blast counts in acute leukemia, cytopenias, leukocytosis in some chronic types, and specific markers like our rods. Together, clinical features and lab tests allow accurate classification, which predicts prognosis and informs therapy choices. Acute lymphoblastic leukemia, or ALL, is common in children, involves lymphoid blasts, and often shows specific immunophenotypic markers. Acute myeloid leukemia, or AML, arises from myeloid precursors, may show our rods, and often requires urgent, intensive therapy. Chronic myeloid leukemia, CML, typically occurs in adults, shows marked leukocytosis, and is defined by a BCR-ABL fusion on testing. Chronic lymphocytic leukemia, CLL, usually affects older adults, often follows an indolent course and shows mature-appearing lymphocytes on smear. Chronic myeloproliferative disorders involve excess production of one or more mature cell lines and can progress or transform over time. Myelodysplastic syndromes feature ineffective blood cell production with cytopenias and dysplastic cells and carry risk of progression to acute leukemia. In summary, leukemia is cancer of blood-forming tissue with acute and chronic forms across myeloid and lymphoid lineages. Diagnosis relies on CBC, peripheral smear, bone marrow examination, flow cytometry, cytogenetics, and molecular testing. Key lab clues include circulating blasts in acute disease, specific markers, cytopenias, and characteristic genetic abnormalities. Major types: all AML, CML, CLL, myeloproliferative disorders, and MDS have distinct features guiding therapy and prognosis. Early detection, accurate classification, and specialist care are central to better outcomes for patients with leukemia. Thank you for watching. For more detail, consult clinical guidelines or a hematology specialist and review labeled diagrams and lab tests shown here.